Hi, my name is Janelle Wessels, and I will be doing the NG tube insertion skills video. So I have my patient here. I have a warm basin full of water, a chuck pad. I have my gloves, my water-soluble jelly, my NG tube, it's an 18 gauge, a glass of water. So first things first is I'm going to bring all of this into the patient's room. I'm going to introduce myself to the patient, go over the procedure that we're going to be doing today, ask them if they have any questions. So did that. So I'm going to introduce myself. My name is Janelle. I will be your nurse today. This is Mr. Jones. Can you please verify your full name and date of birth? So this is Bob Jones. Date of birth is 1/1/2000, and he's here for NG2 placement. So I went ahead and I checked 2 patient identifiers. I verified the order in the MAR and made sure there was the correct order and the correct patient. I went ahead and I performed my hand hygiene. Now I'm going to go ahead and get started. So I'm putting on my clean gloves. These are my clean gloves. And now I'm going to first assess the nares. I don't know where my pen light is, but we're going to pretend this is a pen light. We're going to have the patients tilt their head back so we can assess both of the nares to see if they are, which one's the better one. So we'll assess, we're assessing the nares, we're looking for reddish pink, making sure the mucosa is good. They're both good, both the right and the left. I'm going to go ahead and press down on the left side, have the patient blow out of their right nostril so I can see which one is the better nostril to perform. So go ahead and blow out, Mr. Jones. Okay, I'm going to press the right side. Go ahead and blow out. Okay, so I'm going to go with the left side because it seems to be a little bit stronger. So we're going to go ahead and do that. So first things first, I'm going to go ahead and put the chuck pad on the patient's neck and the stomach so that it doesn't get any wet. I am going to go ahead and open my syringe so that I have it ready, prepared with air. So when I check placement, I can go ahead and open that. I will put the tubing into warm water so that it can loosen up and not be so stiff, be a little bit more flexible. And then I have the patient's water right here next to me. In a perfect world, this would have a straw. So it has a straw so the patient can drink. And then I'm going to go ahead and open up my water-soluble jelly. So I'm opening that up. The tube is nice and flexible. So I'm going to go ahead and check measurements. And how we do that is that we're going to take the tubing from the nose to the ear and then all the way down to the stomach. So I've already put the tape on the 50 mark. And that's how we know how far we're going to go ahead and go in and insert. So let's go ahead and get started. We're going to go ahead and get started, Mr. Jones. We'll take our lubricating jelly. We're going to put that all over the tip so that it's nice and easy for it to go in. So just put that here. This is lubricating jelly. So we're going to go ahead and stick the tubing, have the patient tilt their head back so it's easier. Stick the tubing into the patient. And we're going to go ahead and push and push. If we feel resistance, fine. Okay, so we're going to go ahead and go all the way up. We should hit the marker, and we did. So now we're going to go ahead and make sure that it's the correct placement. So we'll take our stethoscope. We're going to go ahead and listen to the stomach. We'll listen to the stomach, so we'll put that right there. Stethoscope is in, but I have an ear infection, so it kind of hurts. And we're going to go ahead and put this at the end of the tubing, and we will check for placement. So we're going to go ahead and we should hear a whooshing sound or bubbles. That's how we know that we're in the correct spot. Have we not heard those sounds, then we can go ahead and take out the tubing and redo it. But we did hear those sounds. So now that I have checked the placement and everything seems to look okay, I'm going to go ahead and take my syringe again, attach it to the end of the tube, and I'm going to draw back some gastric content so we can test it on a pH strip. So went ahead and did that. Another way that you can check for tubing is you can have the doctor put in an order for an x-ray. So I'm going to go ahead and clamp this until the doctor puts in the order for the x-ray so that we can check fully for placement. And then I'm going to secure the tubing onto the patient with tape. Let's see. Okay, I don't know where my tape went. That's lovely. Oh, it's right here. Okay. So, secure it with tape. Oh my goodness. On my tape, I'm just going to secure the tubing to the nostril, making sure that it's secured and that it can't come out. I'm also going to put this and secure it onto the patient's chest until we can verify from the gastric contents that we took and the chest x-ray that the doctor's going to put in that we actually have the correct placement. Once we verified that, then we can go ahead and continue to use the tubing for whatever reason, medication, feeding, whatever it may be. So once that's done, then I'm going to go ahead and ask the patient how they're doing, how they're feeling okay, move them into a more comfortable position, making sure that they have whatever they need, and really focusing on my bedside manner, putting things within reach, whether that be the remote, the call light, their glass of water, whatever it may be. After that is done, I'm going to go ahead and take off my gloves and perform hand hygiene so that I can go ahead and go and document everything that I've done. So I'm going to go ahead and take off my gloves. Sorry. So now that we have taken off our gloves and we performed our hand hygiene, we're going to say goodbye to the patient. And like I said, we're going to go back and document everything. We're basically going to document everything in the procedures that we did, how the patient tolerated it, what we used. So we used an 18 gauge French, how much air we put in, how much acid that we took, our gastric contents we took out, the length of the tubing. So we went to 50. So we'll document that we went to 50. And then once we have the lab values back, and obviously like the chest x-ray verifying that we had placement, we were going to go ahead and tell the provider what is in the lab values of the gastric content. So what color it was, if it was coffee ground like, then we would notify them right away. If it was normal, then we would just go by putting it in the chart. And then yeah, that is the end of the procedure. Thank you so much.